conversation nationally on health disparities began as a result of Dr. Heckler, who is the Health and Human Services Director, and she did a study over an 18-month period of time looking at over 600 papers. But what came out of that study was this notion and this fact of unequal treatment that confronts our racial and ethnic health disparities in health, in delivery of health care in our country. And so one of the things that really stands out for me is the fact that this is a conversation about race, but it's also a conversation about socioeconomic status. And so the reality with health disparities is you could take a black female and a white female, same insurance, same income, but the treatment of care will be different. So that's what this study told us. Going back a little further, maybe not that much further, the Kerner Commission report. Anybody familiar with that report? So it's a very lengthy report, so I don't know if you want to read the whole thing, but 50 years later, the New York Times actually did a study. You could probably see this article. It appeared a couple of months ago that talked about the fact, in spite of what was said in the Kerner Commission report, and I'm just going to highlight kind of the last part of the conversation. The report berated federal and state governments for failing on housing, education, and social service policies. And so when we talk about health disparities, we're really talking about those quality of life factors that enable any individual to have the opportunity for the best quality of life. And that's what we all want, right? So what's frightening about the Kerner Commission report is that report made all those statements in 1968. And in 2018, the New York Times article talked about the fact that not much has changed. So that brings me back to health disparities and kind of fast forwarding. So this logic model by Robert Wood Johnson Foundation, who is the largest health foundation in the United States, I really applaud Robert Wood Johnson for really helping us change the conversation. The reason that health disparities have not improved, and I'm going to try to use the little laser, but maybe not. Okay, I'm not. So when you look at this logic model, and you look at the fact that 20% of our health is going to the doctor or the health system, 20%. 80% of our health outcomes relate to our health behaviors and environmental conditions. But where's the conversation? The conversation is on quality and access to care and going to the doctor. Now, obviously that is very important. But if the conversation is only in that 20% and not looking at those barriers and social determinant factors that influence one's ability to have a healthy life, you see now why we haven't moved the needle. So I wanted to give you some context on the health gap. We are an organization that is working to eliminate racial and ethnic health disparities in Greater Cincinnati for the most underserved populations of our region. And that's before one is born to that dash in between to the time we leave this earth. Our primary focus is the African American community, but we also have some incredible partnerships with the Appalachian community and Hispanic community. How we are addressing health disparities is through an approach called community-based participatory research, better known as CBPR to us. What it's doing is that we are co-creating the solutions together. So it's not that we are on our own mobilizing, but we are jointly going into a neighborhood and mobilizing people together. And then teaching individuals in the community, what is research? Why is research important? Research is really collecting data so that you understand why you might create a cooking club, why you might create a new walking club, and then how you might measure whether or not that activity or intervention or strategy is impactful around the cause that you're working on in your community. So the key to that conversation is the fact that we're not coming in and saying, hey, we got something great for you. We're coming in and saying, hey, are you ready to roll up your sleeves? And we're together going to figure out what the solutions are so that you are able to sustain those solutions that you create. So how we are doing this work is through what is called our Grassroots mobilization model to eliminate health disparities. And it involves three core components: engaging the very population, stakeholders, policymakers. So this is where we're starting to go into this conversation on social media. So we're engaging all of the players that have some impact upon improving health disparities. And we're empowering not only the individuals, but we're also empowering those stakeholders to understand what those barriers are and how together we're working on improving the education of the consumer or the individual, but also improving the education to the doctor, to the health administrator, so that there is not a solution that one person's going to drive from the top down. It must be a collective solution. So obviously, as you get more knowledge, you're able to advocate. So as that advocacy becomes not just an advocacy from the top down, but it's a bottom-up advocacy. And then we meet in the middle, because we're then going to be able to have a greater impact. And so for us at the Health Gap, that impact means that we're going to create a culture of health in which prevention is the key driver that leads to a significant increase in the quality and length of life of the populations that we're serving. So that's what we're doing at the Health Gap, and now I'm going to talk with you about how that relates to this conversation today, social media and social capital. So as you look at this chart here that describes social capital, we see diversity, we see a sense of belonging, we see networks and bonding and bridging, feelings and trust and safety and reciprocity, participation, citizen power, values, norms, and outlook in life, all leads to social capital. So that involves a lot of different players. And so how we communicate with one another is key to really beginning to move that needle. So, as I look at how we are identifying our social capital with the Health Gap, we're we're working with the marginalized populations, residents in our community. We're working with strategic partners and stakeholders. We're working with public officials. We're working with our board of directors, that's a diverse board. And we're working with social, civic, and faith-based organizations. That's the social capital that's going to help us move the needle, utilizing social media. So that strategy for us involves 5 touch points of engagement. Might be an email, might be posting on Instagram, Twitter, Facebook, might be a phone call, might be a text message. And then we're going to continue to follow up in that process in those 5 touch points that ultimately are going to inform that word of mouth, that new knowledge that we can then talk to each other about. And then some other things that we're going to do on the ground at a grassroots level is we're going to go door to door, we're going to knock on doors. We're going to have in-person events where we can bring people together to talk about subjects as we are today. We're going to do some traditional advertising. We're going to have some print advertising. We're going to have some billboards. We're going to send some advertising out through social media as well. And then we're going to inform and train individuals so that they can be a part of going out and being ambassadors to mobilize that conversation. The biggest keys to engagement, and I think the biggest keys to the Health Gap's ability to continue to mobilize individuals, is that credibility of the authority on the information, followed by consistency and trust. Because the biggest reason we have such gaps in our disparities has to do with the lack of trust that exists in our community. Relationships and partnerships. Identifying leaders and building new leaders. And meeting our audience where they are. I think if I had a laser that could circle, I would say meeting your audience where they are is the biggest key. I think oftentimes strategies are developed with great minds in a room, but it's missing a piece. It's missing the people that it's intended to impact. And so many of the strategies I think that are happening across our nation, across our cities, are usually driven by a group of people who really have a really heart for the issue. And sometimes we get so busy because we're meeting and we're talking and we're going to conferences that we really think we have all the solutions. We don't. We are a part of it. It is a little scary sometimes to bring in people into the conversation that maybe don't have the same, they aren't starting at the same point as you. But I think you're going to have the best outcome when you set that table with everyone. And then providing opportunities for involvement. Again, that kind of likens to what I just said. I think that it is oftentimes very hard to kind of move the table, move the chairs over, and add some new voices that potentially can say, hey, that's not working for me. But that's a risk, because the plan may already be done. And so now you're bringing someone else into the conversation that may kind of upset the apple cart. But you're going to have the biggest opportunity to have an impact on social capital and frankly on whatever the issue is that you're addressing when you broaden that table, when you really use all of these other touch point mechanisms that we now have in our country to really build that voice out bigger so that we can have a greater impact. So, I keep building upon how we at the Health Gap are engaging individuals, and the easy way to say it is it's a grassroots, it's a bottom-up approach versus a top-down approach, and it's on the ground, but we are using digital platforms, and I will have to say it took some time to be able to use digital platforms because we have barriers in our communities where people don't have access to the internet. But the beauty of the smartphone has made a huge impact because almost everyone has a smartphone. Now, one of the challenges for us is that smartphone might be a phone that has a month policy, and that number may change in a month. So that means that slide a few slides ago where I talked about those touch points of on the ground and word of mouth become even more important. Because while we may have a cell phone number that works one month, the next month it may not work. And so we have to build that mobilization through a lot of linkages in order to make sure that message continues to be built on. So the digital platforms are wonderful and I think are accessible, but we have to figure out the right platform to reach the audience. And in the case of the populations that we're serving, text messaging is our best bet. Second best is Facebook. Third best is Twitter. Twitter has worked great for our stakeholders and our partners, but not for the individuals we're serving in the community. So I'm going to talk a little bit about this slide here. We have been in existence 15 years, and we are very fortunate to be founded by the former mayor of the city of Cincinnati, Dwight Tillery. So I'm giving you that information as a point of reference to what I'm about to talk with you about. Dwight is a former public official. And so we became a part of a central focus of media attention for 2 years because he is a former public official. And so there is a law that enables journalists, media, individuals to be able to say whatever they want relative to a public official. And so the great work that was established 15 years ago began to be not the focus of the conversation. The focus of the conversation was having the former mayor of the city of Cincinnati being the focus of the conversation about the health gap and moving the attention away from all of the work that we are accomplishing. And so you're probably asking yourself, why is she talking about this? I'm talking about it because we utilize social media to help negate the negative coverage that we had for 2 years. So in spite of a complaint being launched from the mayor of the city, and then that same complaint resulting from the state auditor's office to the AG's office because of a headline in a story in a local newspaper, in the Inquirer. Those were all the negatives. And so we were able to combat that negative coverage through social media, through word of mouth, through those 5 touch points I talked about. And I thought it was really important to show this because, you know, if we did not have social media and have the platforms, we would not have been able to tell our own story, right? And because of social media and all the diverse platforms, we were able to continue to talk to our constituents, to continue to talk to our stakeholders and say, hey, you know, you may have read this and you may continue to hear this same story, but here's the facts. And so that's the exciting part of how social media and social capital play together. So I'm going to run through these slides real quickly because they're just really kind of highlighting some of the achievements of the Health Gap. We've reached over 126 churches by helping them create health ministries. We've reached over 110 households in one neighborhood with an approach called Block by Block, where we're recruiting individuals, we're training them to deliver an intervention to their peers so that that knowledge can be sustained and they can continue to grow efforts and strategies to improve the quality of life in this particular neighborhood. One of the policy outcomes of that work was they didn't have any place to exercise. Their senior center had closed, their recreation center had closed. But the community residents said, we're not going to stop here. We're going to continue to advocate on improving the physical activity opportunities for us. And so they received a grant from a local foundation. That grant was a planning grant that enabled them to do a physical activity plan. In that plan, they had the hospital, the business association, the community council, the school, and residents all come together collecting data to say, here's our top 5 priorities. It resulted in an elementary school that did not have a playground now has a playground with funds from the Marva Loomis Foundation, followed by a walking track surrounding that playground, all achieved by residents of the community with an on-the-ground strategy, as well as using social media to reach out to stakeholder partners that saw this opportunity. So this is an example of the evidence of what can happen when social media and social capital not collide, but you know what word is I'm looking for. Back to social capital and how to build it and training leaders. We have a community engagement academy that's training individuals on how to mobilize themselves, how to resolve conflicts in the neighborhood, how to reach out to those policymakers that influence the policies that affect the communities in which they live. So it's giving that knowledge and power to people who are part of that social, building that social capital to address the issue of health disparities. Black men's health. Black men are dying faster than any other population. And so having Black men be at their own table saying, hey, here's what we want to do, because as I talk about Black men, this could apply to white men and all men. I think men in general don't want to have but we must have this conversation, right? We must build this dialogue, but I can't build that dialogue, but men can build that dialogue together. And annually, we reach over 15,000 people at an event in a park. And since 2003, we've reached over 110,000 people. And you probably ask, how? So again, back to social media and platforms. It was word of mouth, it was Instagram, it was Facebook, it was Twitter, and it was traditional forms of media, billboards, television, radio. All of that communication resulted in people being able to be made aware of a consumer-focused health fair that enabled people to get over 20 different free health screenings annually and learn about fitness demonstrations, all different types throughout the entire day, a day of fun for the entire family, all about health, and all about being people with knowledge to, again, building upon social capital, not only the residents, but the health systems, the health organizations, the schools, the insurance companies, all of those folks that intersect around this issue of health and health disparities. Now I want to share with you a couple of campaigns.
Girl, I was at this all-you-can-eat restaurant buffet last week, and I saw these kids about 10 years old eating so much, I couldn't believe it. They were so overweight, and their mother just sat there and didn't do anything about it.
Girl, I know what you mean. These kids are so big today. And my nephew spends 5 hours a day watching TV and playing video games.
Overweight and obese children are suffering from hypertension, heart disease, and even type 2 diabetes, shortening their lives. Are we feeding our children to death? The Do Right campaign empowers communities to improve nutrition and increase physical activity. The campaign encourages healthy lifestyles that reduce obesity and obesity-related diseases. Call the Center for Closing the Health Gap for information to help you save your child's life. 513-585-9872. That's at 513-585-9872.
This was the first campaign that the Health Gap launched to really draw attention to the issue of childhood obesity. And what's interesting, there were billboards that were up across the county, and those billboards reflected the three populations we serve. And there was a group out of California that called for the billboards to come down. And the reason they wanted those billboards to come down is that they felt that they were kind of a negative connotation to the children that were pictured. And our response back, and actually it was an overwhelming response back by the community, and this is an example where the Cincinnati Enquirer joined us in saying that this is a good conversation that we should be having about childhood obesity because we are all a part of the solution. And out of that campaign, we launched an intervention that we do in elementary schools. But we were also able to build awareness to not only the community stakeholders that can have an impact on childhood obesity, but the individuals and communities who perhaps didn't really see the role that they played. It was a pretty provocative commercial, pretty provocative billboard, a pretty provocative theme that was developed in collaboration with Cincinnati Children's Hospital. So again, I'm talking to you about ways that the social capital was utilized in creating a message that was talking about a very tough issue, but helping everyone be engaged in the solution. This slide is, and I sometimes throw this out and say, tell me what 14-pound word represents. Can anybody take a guess? Yes. Anybody take a guess? It's not going to be a wrong answer, but this is a guess of what that 1400 might represent in Cincinnati. That's a good guess. It represents diet-related deaths in 2010, a total of 1,400, based upon the death certificates of individuals in the city of Cincinnati. Again, I'm demonstrating to you how you can use different forms of media to tell a story. Now, it was this number that helped us build conversations and efforts with the city of Cincinnati that resulted in our ability to then get policy enacted that begins to address the issue of food deserts in our community. This ad, which is not running, but the statement, you don't have to be in prison to be on death row, seems like a pretty kind of harsh statement. But the point of this statement is, in our communities, people are living in substandard circumstances that, frankly, their likelihood of death is heightened because of the environments that they're living in. So this notion that you don't have to be in prison to be on death row, that was developed by our founder, Dwight Tillery. This statement is talking about what people are living every day in many of our cities across this nation.
In Cincinnati, more than 1,400 people die from diet-related illnesses each year. Grocery chains are leaving the city, leaving little access to fresh food. That leads to higher rates of obesity, diabetes, and more. It's time to do right.
So another partner, American Heart Association, joined us in this conversation on health disparities. They funded these billboards. Everyone should have access to healthy food. We deserve grocery stores too. The American Heart Association funded these billboards that were throughout the city of Cincinnati and helped us be able to do the following. A task force was appointed by the city of Cincinnati, again, public policy, council members joining and saying this is an important issue for our city. Out of that task force, there were 3 core findings in goal areas that we were going to begin to work on together. Improving the access to healthy foods, improving transportation, which I can say is the biggest barrier and it's the hardest one to tackle, and increasing education about healthy eating. So the 2 specific policy outcomes, and in the case of American Heart Association, not only did they provide funding, but they also used their advocacy network to mobilize people around encouraging council and public policymakers to put forth policy that would begin to address these issues. The first was having city council make food deserts an ongoing budget priority in their annual budget process, and that still continues today. The second was the creation of a fund, replicated off of a fund out of Philadelphia, and our fund is called the Cincinnati Fresh Food Retail Finance Fund. If you're ever creating something, think about all the words and the acronym you're going to end up with before you create it. So it's pretty a long title, but basically it is a fund that helps use all the tools in the toolbox for the city of Cincinnati to attract grocery stores to food desert sites in the city of Cincinnati.
I'm Mayor John Cranley, and I believe that every citizen deserves the best chance to be healthy and live a long life. But in our city, there are vulnerable populations who get sicker and die faster than others. It's preventable and it's unacceptable. The Center for Closing the Health Gap is working hard to improve the well-being of our entire community. From health screenings to healthy eating programs, the health gap is making a difference. So join the campaign to end health inequities. Volunteer, donate, advocate. Help us save a life.
So this campaign was really designed to really help people understand what are health disparities. I think that sometimes when you say it, it's like, oh, okay, that's something that doesn't really impact me. This awareness campaign and having the mayor of the city actually talk about the health gap in terms of what we are accomplishing and the fact that we're all going to have to work together was really a core component to our longevity as an organization and really building a bigger conversation about health disparities. What's very exciting for us is that we had, the chief elected office holder in the city saying health disparities matter in our city. Now that was 2014. Today, there's a different conversation from the mayor, and that's where politics comes in. And so I think the reality of social media is that, again, this is a commercial that was run in 2014. This commercial tells a story about the importance of health disparities. Sometimes in silly season of politics and politics in general, conversations get away from the root cause and the factor that we need to be focused on. So in this case, health disparities is still an issue that we must address collectively. And it's an example, though, where social media and media can enable us to continue to tell the positive story in spite of a negative story. So this is our final campaign that was recently launched this year.
Do you know your race can predict how long you live? Things like where you live, where you work, your transportation can affect your health. Cincinnati's most vulnerable populations experience it every day. They don't have the same access to fresh food and health care, and they get sicker and die earlier because of it. But the health gap is making a difference to educate and empower Cincinnatians to take control of their own health, eating better, exercising more, monitoring their health, and helping their neighbors to do the same. I've been a family doctor for more than 20 years, and I see the devastating effect of health disparities every day. But there is hope, and the center is leading the way, no matter your background, no matter where you live or where you work, no matter the color of your skin. The center can help you get engaged and take control of your health. Join the fight. Share your story. Let's close the gap together.
So that campaign is again reinforcing what it's going to take to really begin to see an impact in one's health as it relates to the gaps and disparities that exist. So finally, I want to talk about, how we utilize social media tactics to increase our social capital. One of the things that we've been able to do in the last year is increase the number of Facebook Lives that we do. And these are video conversations from conversations about dental, conversations about mental health, conversations about sleep apnea, the specific factors that are contributing to one's poor health outcomes. We also incorporate infographics in all of our platforms, and we realize that many people don't want to read, and frankly, our nation, we're like at the 11-second attention span that we now have because of all these things coming at us. So infographics have become the best way for us to talk about the outcomes that we're achieving or talk about the numbers that impact the disparities. Share content associated with community issues, so working with different stakeholders to share in the conversation and talking about whatever that primary focus is. And so, for instance, when we talked about sleep apnea, we had a physician that talks alongside of an individual and talking about the impact of how sleep apnea, or not understanding that they had sleep apnea, affected their ability to lead a successful life on a daily basis. Blogging has become a newer way for us to tell our story. So maybe something's printed in the newspaper, or something said in a television commercial or story. Blogging enables us to be able to tell the story from our perspective, as well as maybe have testimonies from individuals who've been impacted. Email newsletter on a regular basis enables us to tell, here's what we're achieving, but here's still what we want you to be a part of being engaged in and helping address the issue of health disparities. as well as pre-recorded videos that help us continue to tell the story. We have multiple platforms, and we've talked a great deal about all of them, but I think the big key here is that social capital involves many stakeholders, many different voices, and social media affords us the greatest opportunity to be able to impact those voices. So I thank you for this